Let's turn our attention now to the state of the pandemic, both in Europe and also here in the U.S. And for more on that, we're joined now by Dr. Ashish K. He is the Dean at the Brown University School of Public Health. We're also joined by Yahoo Finance's Anjali Kemlani. So, Dr. Jha, thanks so much for joining the program. Let's begin with sort of how you would characterize the state of the pandemic, given what we've seen in Europe, certainly concerning, but really just the continued, I wouldn't even say slow, fast burn of the virus through the population here stateside.
Yeah, so thank you so much for having me on. We're at a pretty perilous moment right now. We're generating about 100,000 new infections a day, or at least that's what we're identifying, but we're probably missing 70 to 80% of infections that are out there. And that's a pretty high level of infection. Hospitalizations are starting to rise and deaths are starting to rise. And we have gotten here much earlier than any of us expected we would when we talked about that dreaded second wave in the fall and winter. So pretty tough weeks and months ahead. There's a lot we can do to avoid the lockdown. We're about 4 weeks behind where Europe had been on this newest surge, but we got to act now.
Dr. Jha, looking at one of the things that has been a key problem, and that is testing. We've seen reports of tests that have come out, that nursing homes or businesses have been using that haven't necessarily been accurate. Meanwhile, we've seen overseas in countries like Asia, India, and even in parts of Africa that have done a really good job with testing, despite not necessarily the same sort of stringent FDA oversight that we get here. What can you tell us about what really needs to be done when it comes to getting more tests on the market and what we're missing that other countries have figured out?
Yeah, this is really pathetic. I mean, biomedical stuff is where we as a country tend to shine, and the ability to generate diagnostic tests that are pretty reasonably accurate and widely available is something you would think we would have been able to do many, many months ago. It's been a total failure of federal leadership. If you think about how much it would help our economy, if people could get tested before they got on an airplane, if they could get tested before they go to a restaurant, before they go to school, it would have made an enormous difference in economic activity. And we have just not focused on it. And this is not like we're a month or two in. We're 10 months into this pandemic. It's mostly just mind-boggling to me that this is where we are as a country.
Dr. Jha, Julie here. Thanks for joining us. So if you look to tomorrow's election and what might shift afterwards under a Joe Biden presidency, I mean, we know that President Trump's tone on coronavirus has been frequently scoffing or skeptical. Certainly at certain points, he's been skeptical of mask wearing, for example, just to take one example. What, though, aside from tone, looks different under a Joe Biden presidency? What would you expect on the ground in terms of policy would change?
Yeah. So, what's been interesting about the Trump response is that for a few months, at least, when you had Dr. Fauci, Dr. Birx driving it, it was a lot of evidence-based approaches. In the last couple of months under Dr. Atlas, it's very much been a kind of let it go and let people get infected and hope that we get to immunity. I think the Biden presidency, so first of all, even if Joe Biden wins, he doesn't take office until January. So the next couple of months are going to continue to be driven by that Atlas, let people get infected approach. I think starting in January, you're going to see much bigger push towards testing, much bigger push towards national mask mandates. This is what the Biden team has signaled that they're going to do. And I think probably a ramping up of investments on therapeutics and vaccines in a way that hasn't quite happened under the Trump administration.
I'm glad you brought that up, Dr. Jha, because that's exactly what my question was. We've seen such a huge investment in vaccines, as well as the distribution and administration of it, with pharmacies now being roped in to be able to administer them. But when it comes to therapeutics, as we're seeing the rise in cases right now and the hospitalizations that are coming, there seems to be not enough focus and not enough investment in that. Is it too late to start that process?
Definitely not too late, never too late. But what would have been reasonable would have been that back in April or May, as these new therapeutics like the monoclonal antibodies were being tested, the federal government should have stepped in, helped companies produce tens of millions of doses at risk, financial risk to the government. And we would have had now tens of millions, if not hundreds of millions of doses available for people. Instead, we have tens of thousands of doses. We could go through all of our doses in a couple of days. So again, we find ourselves behind the eight ball because of a lack of federal leadership. But I still think if the Trump administration wanted now, they could ramp that up. And I've heard from the Biden team that they definitely are going to do it when they get into office.
All right, Dr. Ashish Jha is the Dean at the Brown University School of Public Health. Dr. Jha, thank you so much for joining the program. Hopefully we can have you back sometime soon.